Hello, I'm Manuela Lourenço Marques. I'm Portuguese and I'm a European patient advocate. I am the president of andLINFA, a Portuguese association in Portugal, and I am in VASCERN working with the healthcare professions and also the other colleagues of other countries in that are European patients advocates as well. Thank you for being there. Thank you.
Hello, good afternoon. I'm Kirsten van Duinen. I'm a dermatologist from the Netherlands, the Nij Smellinghe Hospital, and I'm working with primary lymphedema adults as children. Thank you.
And hello, everybody. I'm Nele Devoogdt. I'm a physical therapist. I'm working in the hospital, University Hospital in Leuven in Belgium. And I will start with a presentation, with a webinar right now. The webinar will last around 20 to 25 minutes, and I will discuss the role of physical activities and sport activities in primary lymphedema. Now, if we treat patients with lymphedema, in fact, we apply a multi-component treatment. So it means that we do skincare. If patients has wounds, we take also care of the wounds. We do soft tissue techniques. We take care of the weight. We motivate the patients to have a healthy lifestyle. We put a lot of attention to compression therapy. So the multi-component bandages, Velcro wraps, the compression garments, pneumatic compression. We also educate our patients so that they are able to do self-management. We also work on the social and mental well-being. And last but not least, we work on the physical activity level of our patients. And so this is the topic of our webinar of today. Now, the question is, what is that being physically active? It can be different things. So it can be that we do some sport activities like running, but also cycling. It's also possible that we do some strengthening exercises that you see on the slides. But it also can be that we do some walking activities outside, that we cycle to our work, or that we even do household chores. And in fact, we recommend to be physically active during 1 week, 150 to 300 minutes of moderate intensity activities. And so it means like walking, dancing, cycling to our work, or if we do vigorous intensity activities, it's at least 75 minutes to 150 minutes. And I've added here also that we have to combine it with muscle strengthening activities. So not only aerobic activities like walking, swimming, cycling, but also exercises to increase the strength of our muscles. And then is the question, why do we have to do those physical activities and sport activities if we have primary lymphedema? And so I say, okay, stay calm and let's get back to basics. And let's discuss first why we develop an edema. And here on the slide, do you see my arrow? Do you see the arrow? No. Okay, no, that it's okay. Then I will continue like this. So on the slide, you see the blood circulation system. It's the red and blue color. And you see also the lymphatic system. It's the green color. And so you see the heart in the middle of the slide. And so blood with oxygen is transported through the arteries to the tissue, and so through the red color. Yeah. And then the blood without oxygen is transported back with the blue color to the heart, from the heart to the lungs, where the blood is again provided with oxygen. It's transported then back to the heart, from the heart to the tissue. So you have a closed circulation. Yeah. But you see there the word systematic capillaries. These are our blood capillaries. And at the tissue, we have a continuous loss of water and macromolecules into the tissue. So in fact, every person develops continuously edema. It's something natural, and it's the function of our lymphatic system to resorb the water and the macromolecules and to transport it back up to our venous system. Then the question is, why do we develop an edema? So we develop an edema when there is more filtration out of our blood capillary system, but also when the lymphatic system can resorb less the water and the macromolecules and transport it less back to our venous system. Yeah. So once again, why do we develop an edema? If the resorption by the lymph capillaries and the transport by the lymphatic system is less than the filtration out of our blood capillaries. And then we come to what is then the purpose of doing physical activities and sports? It's to stimulate our the resorption and the transport through the lymphatic system, but also to reduce the filtration out of the blood capillaries. And in this way, we will reduce the formation of edema in the tissue. But then the question is, how do we stimulate the resorption of water and macromolecules and the transport through the lymphatic system? And then let's discuss now the lymphatic system. I already discussed the figure that you have seen on the first slides. So the lymphatic system, I think you know this, it's an open system. So the lymphatic system starts with the lymph capillaries. These are really fine tubes. Yeah. And the function of the lymph capillaries is to do the resorption of the lymph, of the water and the macromolecules. And to do this, the lymph capillaries are built up of one small layer of endothelial cells. And as you can see, you see some small lines on the picture. And there are some filaments attached. And when we pull or perform traction on this filament, we can open the endothelial cell, and the fluid, so the water and the macromolecules, may enter the lymph capillary. And once the fluid, the macromolecules have entered the lymph capillary, we call it lymph. Then so the lymph has entered at the lymph capillary, and then if we move them to the figure in the middle, we move the lymph is moved through the pre-collectors up to the lymph collectors. Or the lymph collectors are the lymph vessels. How do these lymph collectors or lymph vessels look like? So it exists also of one layer of endothelial cell. As you can see also on the slides, you also have a lymphatic valve in the lymph vessels. And this gives that the lymph is transported in one direction, so it cannot transport back. And as you can see also on the picture, you also have a muscle. It's a smooth muscle in the wall of the lymph collector. What does this smooth muscle do? So if the lymph enters at the lymph collector, the lymph collector becomes more and more swollen, and like you see on the picture on the right side, becomes more and more swollen. At a certain point, it becomes so swollen that the smooth muscle will automatically contract, and in this way the lymph is moved through the lymph collector, and it moves from lymph ganglion. So this is the space between two valves, from lymph ganglion to the next lymph ganglion, up to a certain lymph node is reached. And the lymph nodes creates that the lymph is filtered, and that there exists protection against certain viruses, bacteriums. And then the lymph passes the lymph nodes, is transported further up to it's brought back into the venous system. And once the lymph is put into the venous system, it's transported again through the circulation and finally it's left out with the urine. So you see that if a patient has edema, for instance, of the legs, it has to follow a long way up to the lymph is finally brought back in the venous system at the level of the neck region. So it's a long way. Let's move then to the effect of doing physical activities and sports activities. And so what do we do if we are physically active? And we contract our muscles. Yeah? The muscles are situated in the neighborhood of the lymph capillaries. So by contracting then our muscle, we also create a traction on the filament, which is attached to the lymph capillary. I just explained it. And when we do this traction by contracting the muscle, then the endothelial cell will open and the lymph, so the fluids, the macromolecules, can enter the lymph capillary. So by doing contractions with the muscle, we stimulate the resorption of fluids and macromolecules. Another effect is by doing our muscle contractions, we will also stimulate the smooth muscle, which is situated in the wall of the lymph collector. So in this way, the lymph collector will contract more easily, and so we stimulate the transport of lymph through the lymph collector. And the last effect is that when we do exercises, physical activities, sports, I think you can remember we breathe more profoundly, and also our heart will beat more intensively. This is because we have to bring all the oxygen to our tissue, and so also our arteries, which are found in the neighborhood of the lymphatics, will also pulsate more, and so the wall and the smooth muscle wall will be more stimulated, and also our lymphatics will contract more intensively. So by doing physical activities, sports, we have a better resorption of water and macromolecules by the lymph capillaries, and we also have a better lymphatic transport through the lymph collectors. Let's take a look now to the science. We have the study of Leuven, and they have demonstrated that by doing muscle activities, and that we have a positive effect on the lymphatic system. So what have they done? So they have tested the effect of muscle contractions in 3 groups of patients. Patients or persons with a normal lymphatic system, so these are the no breast cancer patients. Then patients with a limited lymphatic function, and then one of the patient groups had lymphedema and the other had no lymphedema. And so they did 2 sessions. And one session, so the lymphatic transport was evaluated during rest. And these are the black boxes. The other session, the subjects had to do cycling exercises with the arms, so to create this muscle activity. And what did they see? That in every group there was an increase of the lymphatic transport. And so even in the patients with a disturbance of the lymphatic transport, a disturbance of the lymphatic system, and with lymphedema, there was an improvement of the lymphatic transport. Okay, now this was the first part, that by being physically active and doing sport activities, that we have a good stimulation of our lymphatic system. That also by doing physical activities and sport activities, and we also have a reduction of the filtration out of the blood capillaries. And so we form less edema. Let's take a look why this happens. And we have the veins and our venous system, and the task of the venous system is to bring the blood back to our heart. And so it means that the blood is transported against gravity, yeah, and from the legs to the heart. And that's why that the veins, and you see it on the picture in the middle, that they have valves. And the valves avoid that the blood go down to the feet again. But I've told you, the blood have to go back to the heart. And how can this happen? It's by using our muscle pump. We need our muscles, and we need physical activity, sport activities to bring the blood back to our heart. It's demonstrated here on this picture. And you see on the picture in the middle that the muscle contracts and the blood is pushed up to the heart. Yeah? When it relaxes, the blood does not fall down because of gravity and because you have the valves also in your veins. Another effect of physical activity and sports activities is that if we are active, we also have inspire and expire more profoundly. What happens if we expire and we move our diaphragm up? So it means that the pressure in the belly will decrease and that we have a better flow of the blood in the veins from the legs to the belly. And so we move better and the blood up to the heart. In contrast, when we inspire and we move the diaphragm down, so the pressure in the belly increases, and so we limit the flow of the blood from the legs to the belly. And so by inspiring, expiring, inspiring, and we have a stimulation also of the venous flow of the transport of the blood back from the legs to the heart. Now let's take a look again to the signs. Indeed, we see an effect of doing physical activities, sport activities on the leg lymphedema. This has been shown by the study of Fukushima. It's a randomized crossover study. You do not have to understand what it is because I will explain it to you. So they have included 23 patients all with leg lymphedema, and the 23 patients had to do 3 sessions. At the first session, they had to do active exercises with high intensity while they were wearing compression bandage. The second session, it was on a separate week. They also had to do active exercises with low intensity, also while wearing compression bandage. And the third session, at the third week, they only had to sit, do no muscle contractions while wearing the compression bandage. And let's take a look now to the effect on the change of the leg volume. What do you see? That the change was highest when patients did exercises, so the cycling while wearing the compression bandage. It was highest when it was with high intensity, a little bit less when it was at low intensity, but it was a higher decrease of the leg edema compared to sitting. So it means that the muscle contractions and doing activities, doing sports, decrease the leg edema. Now, we also have a special form of physical activity, and it's doing exercises in the water, and we call it hydrotherapy. What is a little bit a problem? We are humans, and long ago, we were walking on 4 feet, but now in the evolution, we are standing up, and the consequence is that we have a lot of pressure in the legs. So that's why we always form a little bit edema. What happens if we stand in the water? We have the pressure of the water, and so we have less hydrostatic pressure in the legs. And so in the water, and we have less formation, less filtration of fluid and macromolecules out of our blood capillaries. And so this is an advantage of doing activities, muscle contractions in the water, and that we also have the advantage of the pressure of the water. And that's indeed seen by the study of Ergin, and they have looked to the added value of hydrotherapy. And so all of the patients with leg lymphedema received normal conservative treatment with stockings and skincare and NLD, and one group received additionally hydrotherapy. And they saw that the patients who received hydrotherapy had a larger decrease of the edema volume, which is also positive. Now, in fact, we do not only have to do these exercises, the physical activities, the sport activities, because of the positive influence on the circulation, and not only because it has a good effect on this lymphatic system and the blood system, but unfortunately we see also sometimes other problems in patients with lymphedema, and so we also work on the other complaints. And like we see patients who has a big problem regarding the cardiovascular endurance and walking for long distances or cycling for long distances. So it's important that we do also physical activities, sport activities, to improve the endurance of patients, but also to improve the muscle strength and core stability. Core stability, we need this to have, for instance, a good gait pattern, and that we can walk in a very efficient way. We can also do exercises to improve our flexibility, our balance, and last but not least, also because of doing physical activities, doing sports activities, we improve our mental well-being. It gives a lot of happiness. And this has also been shown by scientific studies. You have the study of Doe, and they divided patients into two groups. One group of patients received a complex rehabilitation program consisting of stretching, muscle strengthening, and aerobic exercises. In addition to the conservative treatment, the other group received not this complex rehabilitation, and because of this complex rehabilitation, patients had a better physical functioning, less fatigue, and more muscle strength. So what can we conclude out of my presentation? So we have to do physical activities, sport activities, to have a positive effect on our edema volume, but also on other things, to improve our muscle strength, our cardiovascular endurance, our core stability, to improve the balance, flexibility, and our mental well-being. So our advice is, let's be physically active if we have primary lymphedema. And in this way, we improve our quality of life. Now, I can imagine that you have a lot of questions also about this exercise therapy. Manuela, it's our patient who also has primary lymphedema. And Dr. Kirsten van Duinen, who is the dermatologist, have done some Q&A. So the patient asks questions, and Kirsten, as a professional, as she's a very good professional, has answered these questions based on science and her clinical expertise. And these are the questions that we have answered. So what kind of exercises are recommended? Are resistance exercises allowed? Is high intensity interval training allowed? Is it good to exercise on a vibrating platform? Are some exercises not allowed? Do we have to wear our compression garment or other compression materials while exercising? Is it allowed to exercise without wearing compression? And the last question was, how do we have to plan this exercising in daily life? So I want to thank you for your presence during this webinar. We are going to answer your questions with a lot of pleasure. So if you have questions, just ask them. Thank you.
Thank you, Professor Nele. And I think now it's time for question and answers. And we received some of them during the registrations. So maybe we can start, but please do not hesitate to ask anything else, because we are here to answer you back. And if you cannot answer immediately, we can do it later on. But to start with, I think we can conclude that exercise is the most important thing that to do for lymphedema. But are there any special exercise that we cannot do? If, for instance, if I have my lymphedema in my right or left leg, can I run normally, or it's better not to do it? Or it's okay if I can do any kind of exercise, or can I avoid some of them?
Thank you, Manuela. That's a lot of questions. Yes, I think, yes, you can do any sports you like. You can go running. You have to assess yourself, just to have a look at your lymphedema, what it's doing, if it's going all right during the exercise, but especially afterwards. Yes, it can swell a little afterwards, but see the next day, is it gone or not? Have I done too much, or is it okay? So yes, you can do anything you would like, but check yourself on your lymphedema.
Thank you. I don't know if Professor Nele has something to add or not.
No, I only can confirm what Kirsten or Dr. van Duinen was telling us. I also have the experience that a lot of patients are afraid of doing resistance exercises. And we see in literature they have really investigated the effect of doing resistance exercises on the volume. It has already been investigated for many years, and there is really consensus that doing resistance exercises do not increase the volume. In the contrary, at this moment, there are already studies who say we have to do resistance exercises because it reduces our edema volume. So it's the contrary.
One of the patients asked about golf. Is it anything against golf, or it's a normal sport that we can do as any other one?
No, if golf is in my opinion, a very good physical activity. So if we have patients with leg lymphedema, we walk a lot. And I also explained it we need this muscle pump. Standing a lot is not the best activity, but when we do golfing, we walk a lot. So this is positive. If we then move to the patients with arm lymphedema, also golfing, it's a very supple, very gentle movement. We use our muscle pump. There is no problem at all to do golf activities. So it can that if you also have like muscular problem, musculoskeletal problem, some pain at your shoulder, that by doing the golf movement that you have some pain. But it's not because of the edema, it's because of your musculoskeletal problem. And so it's always important, if you feel something, that maybe you discuss it with your medical doctor or with your physical therapist, from what comes the problem.
Another question. If, for instance, I suppose that we have to do the exercises with bandage, am I correct? Or can we do it without bandage, without compression?
I would suggest you use the compression to help your lymphedema. Sometimes it's a little bit hard because of the compression is very tough. If possible, your lymphedema is not that severe, you can use a lower class, for example, or sporting compression socks. Could also be, but then it should be not that the lymphedema is very severe for you. Otherwise, you should wear your own compression. I would suggest that.
What about if it hurts?
Yes, let's have a look. What is hurting you? So
Okay.
if it's really your compression or not,
Yeah.
how do you wear it? Where is the problem? Maybe we can do with something with softening tissue underneath it, or you can try the lower class. It's also, but then maybe it's good to ask your physician about that.
One of the patients also asked what are the manage after the exercise about the shower and the changing compression. I don't know exactly what that means, because normally after exercise we always shower and we have to move the compressions and things like that, and we have to put it again. That's what I do, but I don't know if it's what if what I do it's correct or not, because I always use compression 24 hours a day almost. So
Yeah, but yeah, indeed, we have to shower. So we have to take off our compression garments, and then in fact, it's not easily to put it immediately on because our skin is a little bit wet. It's not completely dry. Now, it's also the same when patients went to the swimming pool. It's always difficult to put the compression garment, which is sometimes already very difficult to bring it on. Try first your donning system. So maybe a small bag that slides very well, so you can more easily put the compression garment over the leg or over the arm. If it's still too difficult, then you maybe can think about putting on a compression wrap if you have it. It's not always that you have it, but if it's possible, put on a compression wrap because this is more easily, because you can put the wraps around the leg or the arm, or maybe to put on a bandage.
okay, thank you. And again, I will invite everybody to ask wherever we feel that we have to ask to us, and then we can continue with another question that we have in the previous ones, which is, what clinical signs indicate that physical exercise should be interrupted or readjusted in a patient with lymphedema? What are the signs?
Yeah. So when you're feeling ill, if your leg or arm is getting red, that's are the signs you have to check yourself if there's maybe a cellulitis going on, or is it just a little crack in your skin, or so you have to listen to what's going on and check what's happening. Is it a compression? Is it something else? Are you getting ill?
Yeah. Now, maybe I can add. Sometimes we see also patients, and the leg becomes red. And you have a reaction of the skin, and it's a sign of inflammation of the skin. But this does not mean that there is a bacterial infection. And so if you have this redness and you are a little bit insecure, always go to your medical doctor. And so the doctor can verify whether it's a bacterial infection. But normally this is also combined with a fever. Or is it an inflammation, maybe an effect of the slippage of your compression garments, maybe, and that gives that your skin has become red. And so it must be always verified why is there a coloring of the skin.
Yes, and you
Sorry. Go ahead.
and you sometimes you get a little red when you exercise, huh? So check the other leg or your arm if it's getting the same color or not.
Yeah, that you are speaking about cellulitis or erysipelas, as we say in Portuguese, and I'm just thinking that VASCERN has also urged everybody to look to the website, because you can have that tool to just find out what is only a redness or it is more than that. Just a suggestion for everybody who's listening to us.
Yeah, Manuela, you were just a moment gone. I will maybe repeat it. So it's really interesting what Manuela was explaining. So together with the VASCERN team, we work on different informational tools for patients with primary lymphedema. And one of the informational infographic that we have made was about what is cellulitis of this bacterial infection, how can we recognize it, what do we have to do if it comes several times, how can we prevent it. So you can find things like this on the VASCERN websites. It's really interesting if you need some additional information.
Yeah, and it's written in different languages, so it's not necessary to go to English one, because just look for your language, maybe it's there as well. So it's quite nice. And if you have children as well, you have also a nice coloring book for some cares about that. So another question here, it is, can a regular physical exercise prevent the lymphedema or high risk patients or not? Can regular physical exercise prevent the development of
Oh, yes.
lymphedema in high risk patients?
Yes. So, are we doing good on physical exercise? So the lymphedema is not getting worse. Yes, I think it's good to move because as Professor Devoogdt already explained, it's really good to do your exercise to get less volume during the exercise and keep it in balance.
Okay, so we can. So I don't know if you have any questions on the question and answers. I don't think we have. So I cannot see. Could you help me on that, treasurer? Because I cannot see any question here.
Yes,
Yeah,
I see. Shall I
Okay.
read it?
Yes, please.
And user, I didn't get how physical activity reduces filtration. I thought it increases it.
Okay.
Could you answer that?
Shall I answer this? Because this was part of my presentation. So if we do physical activity and we have a muscle pump, and so we do contraction, relaxation of the muscle, and like I explained, our venous system does not have an active pump in the wall of the vessel. So we need an external system to bring the blood back to our heart. Yeah. And so one system that is useful is our muscle pump. So by contracting around the deep veins, so the blood in the vein is then pushed up to the next compartment of the vein between the valves. And by every time contracting, the blood is moved up. So this is one system. The other system is if we are physically active, we are going to inspire, expire more profoundly. So we move our diaphragm up and down. So we change the pressure in our belly. So by reducing pressure, and there is a suction effect of the venous blood of the legs to the belly. So also by inspiring, expiring, we have a stimulation of the blood flow from the legs to the heart. And so in the past, indeed, we always thought if we do a lot of exercise, a lot of strenuous exercise, we create edema. Yeah. And so that's why patients, for a long time received the advice not to exercise. Yeah. And now we know by also doing some scientific studies that so they really have examined this, investigated this, that if patients do exercises, even like they looked to the effect of doing rowing exercises in breast cancer patients, and they saw that the edema volume did not increase, and that also in patients, for instance, at risk of developing edema, they did not develop edema. Yeah? And now it's even the contrary. And so that by doing exercises, that you reduce the edema and that you also prevent the development of edema. So it's even the contrary. I hope it's a little bit clearer right now.
Yeah, I think so. For me, it was perfect. But if anyone has doubts, please write on chat. I don't know, Dr. Kirsten, could you help me? I cannot see the question and answer, so I don't know if you have more or not. If you don't have
No.
anyone, no.
I don't
So-
see any new ones.
Thank you, doctor. So I think if we don't have anything else, we have to just invited you to see again and ask questions later on, and we try to answer back. Is that so, Treasure?
Your micro is not
Good. So if you register for the webinar and you have any follow-up questions, please reply back to the emails that have been sent, and I will transfer the questions to our speakers for today. Thank you so much, Nele. Thank you so much, Manuela. Thank you so much, Kirsten. I think it has been a very informative session. Actually, one question just popped up, actually.
Okay.
Maybe I can read it.
Yes, please.
Yes, so it says, our son is 17 years old and has primary lymphedema in the left leg, so the lower part. He's doing elite sport on a high level, so handball, I believe, in his spare time. In school, does he have to get up and do exercises during classes? I'm not sure.
But I think she asks whether they have to give up at this because it's a lot of doing sport activities. And so I think the question is, do we have to change the amount of exercising? I think most important is to follow up the edema in a very good way. So to do assessments, if the 17-year-old boy can continue with his high level of exercises, and the edema stays stable and there are no other complaints, then it's possible. Now, if I move to the clinic, sometimes, but it's really sometimes, it's really rare. We have patients who really sports a lot, really intensive, and they have several times, very regularly, bacterial infections, erysipelas. Then, in that case, we sometimes say, okay, try to reduce a little bit the frequency and the intensity. But for us, for our clinic, these are the only cases where we say that patients has to reduce. And of course, if we see that there is an increase of the edema volume. And so that's why that assessing is also really important.
I really agree.
Thank you.
Thank you so much. I hope to the person who asked the question, I hope you answered your question. But if you need more clarifications, please do let us know. Thank you very much. So if there are no further questions, maybe wait a few minutes more. But if there are no further questions, then we would end the webinar. But just for information, so the cellulitis flowchart that was mentioned, Manuela mentioned actually, I will send via email with the link to the different languages, so you can also have a look at this flowchart. And also the recording of this webinar will be available on YouTube. There's also the World Lymphedema Day that is happening on Friday, the 6th of March. And Nele presented a few of the questions that were pre-recorded. So these videos will also be available as well. So please do follow us on social media. I think many of you registered for this webinar through social media. So please do follow us, continue to follow us, and keep an eye out for these videos. And also follow us on YouTube. So subscribe. It's all at VASCERN. VASCERN, and you subscribe, put the notification button so you know when there's a new video that is up on the channel. And we will also send an email as well to all those who are registered with the different links for you to connect as well. Okay, I don't see any new questions.
Thank you for being here. Then.
All right. Okay. We might have a new one. Okay, I think it's in Spanish.
Okay, let me see if I can understand Spanish. She has primary lymphedema and also lipedema, and is also connected with menopause, and also but it also cancer in what kind of it cancer is not primary lymphedema, secondary lymphedema is not a rare disease. But anyway, we can. I don't know if Professor Nele or Dr. Kirsten can answer that back, because she wants to know what kind of exercise she can do it.
Yeah, maybe I did a little bit of translation, just the same thing, Manuela, you said. She has primary lymphedema in her legs and also lipedema that were detected during menopause. Now she's an oncology patient with ovarian cancer and undergoing treatment, and she wants to know what exercises or type of rehabilitation would be appropriate.
Yeah. But it's in fact exactly the same as we discussed right now. For us, there is no difference in exercising, being physically active, sports in primary or secondary lymphedema. And the reason why persons develop edema is different, but the treatment in fact is more or less similar. So you can do exactly the same things that we discussed right now. And my recommendation is also look for something that you like. It's otherwise you will not be motivated to continue to be physically active. And that's why we also here in the clinic offer patients a lot of physical ways of being physically active, so that they can experience what do I like, and finally patients choose themselves, how am I physically active.
Yeah, maybe I can push for Nordic walking, because they have that in Spain, so they can do it. I don't know.
Yeah. And sometimes after oncology treatment, you have to start a little bit slower, but then you can build it up. And sometimes you can have a hand with a professional who can help you to train.
Mm-hmm.
Great. Thank you so much. I was just saying if we can also maybe give it in the answers a very concise manner, translate in Spanish for this person who asked this question. But thank you so much. Okay, so again, maybe another question is going to pop up. Because I think every time we say, so if there are no more questions, we're going to round up, and everyone remembers, yes, I have this question. So it's quite interesting. But yeah, okay. If 1 more minute, if you have any questions still left unanswered, please do send it now. But I think it's a very interesting presentation.
I think we have to count down, okay, Treasure? We have to answers.
5, 4, 3, 2, 1. Okay. All right. If there are no more questions, any questions that you have, please send it via email, and then we will send it to our speakers. Thank you so much for presenting, Nele. Thank you so much, Manuela. Thank you so much, Kirsten, for joining us this evening. And I hope that the people who joined us have found this session very informative, and also looking forward to the recording so they can always go back to rewatch, and also the recorded videos. I think that would be very, very wonderful. Thank you so much, and have a good evening.